What if you were a software developer or a web designer or an accountant, and you could say to your clients, you can have as much of our service as you want and it won't cost you a cent. I expect that you'd be pretty busy. But that's silly, isn't it? How could anyone get professional services like that free? Well, ask Canada's doctors. That's exactly what our healthcare system is created for them. And I'd guess that if similar systems were created for those other services, they would function about as well as our healthcare system does now. That is to say, very poorly. Being in my 7th decade of life, I've developed some non-critical age-related medical issues. I've been waiting several months for minor surgery. I have no indication of when that surgery will be, no way to find out even where I am in the lineup. When I call the doctor's office, they don't answer the phone and they don't even take a message. A friend of mine, about the same age, needs a hip replacement. She's been told that her total wait time will be close to 2 years. Leading up to our surgeries, my friend and I have been seeing several different doctors and visiting clinics for tests. These have unfailingly been unpleasant experiences. In every case, after paying an outrageous fee for parking, we arrive at our appointed time, then we're made to wait for up to 20 minutes or more before being ushered into a small, windowless room. When the doctor shows up, we're lucky if the visit lasts even 5 minutes. In both the reception area and these little rooms, there's nothing to read nor view, and we're prohibited from using our cell phones. One time, I went back to one of these clinics to tell the doctor that I'd forgotten to mention a couple of symptoms. I told the receptionist that I only needed a couple of minutes of the doctor's time. After waiting 20 minutes, the next thing I knew, I was in one of those boring little rooms, having my blood pressure taken and waiting another half hour for the doctor to show up. Do you think maybe that doctors being paid per visit might have had something to do with that particular form of disrespect? Have you noticed that most of these locations sport a sign that says something to the effect of, "Abuse will not be tolerated"? I find it interesting that only the medical fraternity seems to find it necessary to post these signs. I don't recall seeing them in any other businesses. Could this be a case of what goes around comes around? My friend and I, and everybody we know, consider the kind of treatment I've been describing as, at the very least, disrespectful, if not outright abusive. If any other business treated their customers as badly as the medical fraternity does, they'd be out of business overnight, except, of course, those that are coercive monopolies. I have a message for all of you who continue this disrespect. Shame on you. Didn't your parents tell you about basic human decency? Don't you know the golden rule? Is this how you do unto others? I say again, shame on you. If I ran the healthcare system, things would be different. Good morning, everyone. You'll notice that some of the old guard is no longer with us. The reason is very simple. They weren't doing their jobs. Legal, I want you to do everything in your power to ensure that those people get an absolute minimum of severance pay. We can't have the taxpayers rewarding incompetents. And for you new arrivals, welcome aboard. As you heard in the previous rant, our customers are not very happy with us. So from here on, things are going to be different. First, we have to change our attitude toward the people we are supposed to be serving. Calling them patients implies an unequal relationship. From here on in, we will refer to the people we serve as clients, and we will treat them with all the respect that that name implies. After our latest round of decentralization succeeded in bringing our services closer to the clients, it's nice to see everyone attending this meeting remotely. And kudos to IT for setting us up on this system that's freely available and costs next to nothing. It's nice that we can see each other's faces and just type your questions. The most obvious problem we face is that the system is really bogged down. We have either too many clients, too few health providers, or both. We need to find out what the actual case is and why. Here's one factor. It appears that it's very difficult for our clients to interact with their healthcare providers any other way than by physically going to see them. Here in the 21st century, that is patently ridiculous. If we can do our banking online and by phone, surely we can find secure ways for people to interact with their healthcare providers in the same ways. That rant implied that one of the underlying reasons that the system is so bogged down is that healthcare providers are paid per visit, per physical visit. The more clients they bring into their offices and the less time they spend with each, the more money they make. This certainly has the appearance of a system that encourages and rewards overcrowding. IT, I want you and your people to immediately set up a system whereby our clients can interact with healthcare providers securely by phone and online. This is to include getting medical results and finding out in real time where they are in the queue for treatment. Research, I want you to investigate how much of the system's overcrowding is due to clients who could do business with us using that system that IT is setting up, but are forced to make physical visits instead. Here's a question. Why did he refer to us as the medical fraternity instead of the medical profession? Simple. Professionals wouldn't treat their clients that badly. Another theory to explain the overcrowding is that because our services are locally free, people are running to the doctor whether or not there's anything really wrong with them. So research, I want you to investigate the healthcare implications of instigating a small fee per visit to discourage the hypochondriacs. This may be as low as $5 or $10. Let us know what amount is reasonable, how you're going to handle those who can't even pay that much, and how effective you believe it will be. Give us any recommendations you can make on how to distinguish the hypochondriacs from those with legitimate medical conditions. While you're at it, take a look at the combination of public and private healthcare system they use in Australia and New Zealand, and let us know if any of that could work here. Another serious issue raised by that rant is that we are not keeping our agreements about appointments. If I agree to meet someone at a certain time, it seems to me only common human decency for that someone to be there at the agreed time and to be present for the full duration of the meeting. So, no more of this booking a 1-hour appointment for a 5-minute meeting, and no more paying the healthcare providers per visit. From here on, we're going to pay them only for time actually spent interacting with the client. IT, can your technology use precision GPS or RFID or something like that to report where a person is within a few centimeters? Yes? Okay, good. Legal, listen up, because this will require some new rules. We will require the healthcare provider to wear one of these devices at all times during business hours, except during breaks. When clients come in, they will be given a similar device to hang around the neck while they're there. Providers will only be paid for the time they are in the same room as and within 2 meters of the client. It seems that there are already systems in place for penalizing clients for missing appointments, but no equivalent for healthcare providers. So here's what we're going to do about that. Within the scheduled appointment, for each minute the client is present and the healthcare provider is not in the same room and within 2 meters of the client, the provider will be fined. Research, give us a recommendation on how much per minute that fine should be. Similar rules will apply to online meetings. Here's another question. What about an emergency that has to bump the time of an appointment? Don't we have to handle those? Yes, that's an excellent question. First, it appears that this is the common excuse for our unfriendly client appointment system. But you're right, we have to be fair about handling the true emergencies. Research, here's another job for you. There's probably research out there to give an indication of what type of medical conditions constitute an emergency and which conditions should take priority over others for consultation or treatment. Find out which percentage of visits to the doctor's offices, clinics, and even emergency rooms qualify as true emergencies according to those criteria. My guess is that with the possible exception of emergency rooms, that percentage is much lower than is justified by our present disrespectful appointment system. Given that information, the only time clients should be kept waiting without penalty to the providers is when there are one or more true emergencies ahead of them. Another question. You mentioned that one of the causes of overcrowding may be lack of healthcare providers. Won't this cause many of them to go elsewhere? It probably will, but I'm not sure I buy the implication that that's a bad thing. There are thousands of highly qualified people in other countries out there who would be eager to come here to work. I think it's a national disgrace that we don't recognize qualifications from other countries, many of whom have standards higher than ours. Legal, this could be a tough one, but I want you to investigate how we might make use of that international talent pool. As for those healthcare providers who choose to go elsewhere, let's ask ourselves this. Do we want to keep those around who are effectively gouging the taxpayers and the clients? Or would we prefer to have highly qualified individuals who are thankful to get any kind of work in their chosen profession? Okay, next topic. IT, another job for you. Most of our facilities ban cell phone use, citing either client confidentiality or sensitive equipment. Investigate the truth of these claims and report back. If confidentiality is the issue, a ban on photography might be less intrusive to the majority of innocent clients. If sensitive equipment is the issue, prove it. If it does turn out to be true that the equipment is sensitive in some cases, contact the manufacturers about better shielding. John and Janet, I want you to set up a new department of client relations. Work with IT on the cell phone issue, as well as asking clients what else we can do to make their waits more comfortable. Perhaps take a tip from the sports bars, where there are TVs on several channels muted with closed captioning on. Ask the clients which magazines they'd like to have available. Another question. What about parking? Oh yes, one of the most frequent complaints we get is about the high cost of parking at our facilities. Research, I want you to take a look at alternatives. Take a look at adapting a system like Calgary's Park Plus, where people can start and end parking sessions using their phones and actually only pay for the actual time they're there. The Park Plus rates are also very high, so bring us some recommendations of how to bring those rates down for us. The problems with parking at our facilities are not just about the price. The design of our parkades at our hospitals is guaranteed to waste clients' time. Instead of having a ramp to quickly get up to the first level with free spaces, clients have to drive through the entire structure. There are private and municipal systems in use that show clients where the next available parking space is and guide them to it. Facilities, I want you to work with IT to retrofit all of our existing parking structures with similar systems. When we build new parking structures, find a more client-friendly design. Okay, that's it for now. Let's get back to work. Well, wouldn't that be nice? Everything I said during my rant at the start is true. A few of the things I said as CEO were guesses. If I've said anything that isn't true, please let me know, and you have my apology. I realize that my complaints are relatively minor. For many others, this is quite literally deadly serious stuff. Here in Alberta, people have been known to die and to give birth while being ignored in waiting rooms. My friend waiting for her hip replacement is often in pain. We realize that other people who are being mistreated by the system are in far more severe chronic pain, but still made to wait for an unreasonable amount of time. So yes, this is important. I'd like to believe that the combination of video and social media is one of the most powerful weapons at our disposal for bringing about significant change. We'd like you to help us prove that, to help us make this and subsequent videos make a significant difference. To that end, please talk to your MLA or your MPP, your healthcare providers and their associations, to the media in your community, to your friends, and to anyone else you can think of, and give them links to these videos. We'd like to make more of these videos. Please contact us with your ideas. Rather than more horror stories, we'd far prefer more and better ideas on how to improve our healthcare systems. If you think you'd like to make a video of your own on this topic, let us know. If we like your idea, we have the resources to, as Captain Parkade would say, make it so. Speaking of resources, we want to make the production of videos like these sustainable. To make that so, if you'd like to contribute a few dollars to help keep us going, it would be much appreciated. As I said in the video, even $5 or $10 can make a difference. And of course, if you want to contribute more, we won't refuse it. We will put it to good use, making more of these videos. Now, maybe it's all just a pipe dream to think we can make a significant difference this way. But as the lady said in that song from South Pacific, if you don't have a dream, how are you going to have a dream come true? Maybe things will just go on the way they have been. Well, I hope not. I guess the only way we're going to find out is to give it our best shot. Thank you for watching, and thank you in advance for any help you care to give.